No, very good. Okay, so do you ever get people that come and just specifically only use PMF?
Yes.
Yeah. Okay.
Yes.
Can you tell me about who that or yeah, and are you getting benefits just with that?
Absolutely. So examples would be, just trying to think of real examples for you. There's a lady that comes in through her anxieties, really struggles to breathe. And she has found that the Hugo is the only thing that helps her. So she phones up, she says, I'm having a really rough time. My anxieties are through the roof. Shallow breathing. And she goes on the Hugo and she puts it as high as she can cope with. And afterwards, it completely settles her. So it's impacting the nervous system and it's just allowing her to have that expansion. Obviously, what it's doing without getting into the science of it, the outcome of what it's doing is increasing the diameter of the blood vessels. It's stopping the Relu effect that tends to happen where the red blood cells stick together. So there's more surface area for the oxygen to actually penetrate the cell. So you get not only a better volume of blood, but you get a better oxygenated blood. And all of those things are serving to support her breathing. So that's one example. The other thing that the M field is incredible for is arthritic conditions. Phenomenal with hands and any other condition really, but we see a huge result with hands and wrists. So people will come and rather than being on medication, they'll come regularly when the pain gets a bit too much and they'll have maybe 3 or 4 sessions to start and then we put them on a maintenance program where they come regularly for that. So yes, there are definitely circumstances where we might put people, if we find muscles, for example, that are not engaging properly, we'll have a series of treatment for them just to get that muscle engaging. So that's all they will have. Another way that I use it is I do some other technologies, which maybe we can come to a little bit later. But when I've identified certain things with a different technology, I will often, when people are dealing with very low energy, or they have got high anxiety, I would have a series of Hugo sessions for them in order to just put them in a better place to be able to then take the next step forward. Because sometimes we're seeing a lot of this where people are so depleted of energy, their energy levels are so low that they don't have the energy or the mental capacity to take that next step. So it's easy to come and say, listen, do this 3 times a week for a couple of weeks and see that improve so that you can then start to make better decisions for your long-term well-being.
And is that chronic fatigue syndrome that seems to be something that's coming up quite a lot and more frequently spoken about now?
Yeah.
Is that people that specifically with chronic fatigue syndrome or just in general people that have really, really low energy levels, or is...
In my experience, I've not worked with a lot of people with chronic fatigue, so we don't necessarily have people coming in with that diagnosis, but the symptoms are very similar. And I think if left unaddressed, it would result in that kind of diagnosis, fibromyalgia, chronic fatigue syndrome. But yes, so not specifically, but the symptoms are similar.
Yeah, okay.
Yeah.